You're listening to Radio Cosmos.
All night long.
Bravo! My compliments, little lady.
Commercial!
Break for 30 seconds.
You are now listening to BaaD Radio.
Hello and welcome to BaaD Radio. BaaD stands for Business at a Distance. This is a show about local businesses and business networking. We are here in the News Radio WFLA Orlando studios from 11 a.m. to 1. Oh, I screwed that up. It's 11 a.m. to noon every Sunday, and I'm your host, Angela Smarito. And before we jump into the show, I want to give a shout out to some of our show sponsors because without their support, we wouldn't be here now. First off is Forge IT Consulting, providing a fully outsourced IT department with a personal touch for small business, and Osteopathic Health of Orlando. They offer integrative medicine and regenerative medicine and so much more. Visit osteopathic.healthcare. All right, so we have Dr. Stephanie Kern back in the house with us today. And just to reiterate, yes, my show is on from 11 to noon. I do want to go back to the 11 to 1 o'clock soon, so just have to get everything in order to get that done. Because it got to a point where I was having a hard time keeping up with just like life in general. And so I'm like, can we just do that for a little while? But I miss having the 2-hour show. So how have you been?
Good. Yeah, just rocking, everything going well. And
right. Well, I'm very happy to have you back in studio because I want to see how things have been going since the last time. So it's been about 3 months, I think, since the last time you were in.
Time flies.
Yeah. And how's business?
Good. Nice, steady. We see, like in my area, because I'm sure it's different for different areas in Florida due to tourism and kids back in school or out of summer and things like that. But in my area, in Castleberry area, we've seen a very big influx of people seeking care around this time of year.
Really? I figured it would be light just because people are going on vacation and stuff. But I meant, that's great. That means that people are taking better care of themselves, right? Mm-hmm. So, well, I already know all about your business, but not all the listeners do. So let's just go ahead and start from the chiro side, chiropractic. So, primarily, you are Dr. Stephanie Kern, chiropractor, correct?
Yes.
Okay. I said Kern. So tell us how you got into that in the first place.
Yeah, so I was about in early college years trying to dabble in general sciences and see what I wanted to do. My uncle's a chiropractor and has been a chiropractor well before me in North Carolina. So I went up and shadowed him for a weekend and kind of see how he helped people, hands-on. And I don't know if I ever told you that story.
No.
But his story was really inspiring to me as well, how he got into chiropractic.
Well, how old were you at this time?
I was around 19.
Okay.
And then, so then I kind of was like, oh, maybe I'll do nursing, whatever. So then I got to shadow his practice and see everything he was doing. And what he was doing is very similar to what I'm doing now. And that's how it inspired me to be a chiropractor.
That's really nice. It's a family thing. Mm-hmm. How did you end up in Orlando?
Well, I was born and raised in Port Orange, Florida,
okay.
So it's not too far of a jump. That's where my family is. And so I practiced here and there throughout different places in Florida and just ended up in Orlando.
But at some point, did you work for another like a bigger chiropractic
Oh,
office?
yeah. I've worked for a lot of different chiropractors, and ultimately my goal was to own and operate my own business and run things myself because I have a business degree as well as a chiropractic doctorate. So, after a few years, that kind of with the pandemic and everything, it just got a little hazy on if that was going to happen or not. Right. So I just decided to take the jump and say, hey, it's now or never, and opened up my practice in 2020.
Well, that's a very brave time to open up, especially with a chiropractic, because that's like a hands-on type of business. Mm-hmm. And so since then, it's grown. So you've added a whole lot of different things, but it's there. What I like about it is that it's all about health and wellness from a natural point versus Western medicine. Mm-hmm. So let's talk about the different things that you offer now.
Yeah. So, I mean, just talking about the United States in general, we see a lot of sick care. We see a lot of people getting pushed towards medications, routine injections, and surgery. And so ultimately, I wanted a safe place for people to come in and try everything they could do to avoid those things that have shown to be ineffective. So we do chiropractic, we do all kinds of physiotherapies and massage and spinal decompression treatments to help patients with their joint pains and aches naturally. And then, if they're really bad cases and they've tried everything, and, that's where we have a little bit of the medical side sprinkled in to where we're doing some regenerative medicine to kick the can down the road even further and give them more options for natural care.
Right. And again, but it is natural. It's just you're helping the body boost itself. So that's the part that I like, is that our bodies are meant to heal itself. We could just give it a nice little nudge and the things that it needs to do that. So I think more and more and more these days, people are turning to natural remedies versus the pill. I went back and watched the first show, and I had forgotten some of the amazing things that you had said in regards to opioids. And I want to talk about that a little bit more, because at that time, you said a study had just come out and said that if somebody goes to a regular primary care for back pain, and they're like, okay, well, here's, what is it now, oxycodone, or I don't even know what they have out there, but are they still prescribing that stuff for people?
Oh, yeah. I mean, they prescribe what they can to shut the body's pain receptors off and to just stop feeling pain and masking it, and kind of shutting down the body's natural response to something wrong. So, we don't want to put a Band-Aid on something. So, when we're going to a medical doctor or going to your primary, you expect them to help you and give you the best, way to help your pain. And sometimes they're not trained in nutrition. They're not trained in natural remedies. They're trained in toxicology, pharmacology, ordering tests, and sometimes not any tests. And say, oh, well, you have pain here. Here's a prescription for an anti-inflammatory. Let's just stop you from feeling pain, rather than digging deeper and kind of seeing what the root cause is, whether it's a joint, pressing on a nerve, or, maybe an untreated joint issue or arthritis or whatever that may be.
But you had mentioned that the likelihood of becoming addicted to opioids was in the 90 percentile.
Yes, it was very high, yeah.
And that is insane to me. I mean, it's so frightening, to be honest with you, that I'm surprised that they're even allowed to still write a script.
Yeah, they've passed some new laws where, there's a limit to how many, doses you can prescribe a patient. People, if they go to an urgent care, ER care, some doctors aren't able to prescribe, if they're being seen by a nurse practitioner or something like that as a primary care. So they have a lot of restrictions on who can even, prescribe these types of medications.
Well, that's good to hear.
So yeah, we try to give everybody the option to get down to the root cause and obviously, avoid, getting on those heavy medications that have really serious side effects.
Yeah, absolutely. So when somebody comes in, and I think that you had mentioned that back pain is the number one reason most of the time people come in, are you able to give them sort of an instant relief? Because I think that that's what the issue is people aren't willing to take the time
right.
to find the root cause. They are like, I'm hurting now, I need relief. Do whatever you need to do. Is that what kind of how it works?
It depends on how serious something is that's going on. I've had patients that can't even sit down in a chair come into my office because of how severe their back pain is.
Right.
So, what we do is natural. So we kind of aid the body's process and speed up the healing process with natural remedies. In some cases, we do get patients to have some relief on the first visit. Some cases, I'm like, hey, we can't even lay you on the table to do what we need to do. So in those cases, I refer them to my nurse, say, hey, they need, maybe a muscle relaxer or something temporary to kind of be able to get them in a position to do what we can do as chiropractors.
And as a chiropractor, you can go in there and maybe make some adjustments. So you get them slightly out of pain enough to where you can get them and do the natural type of healing.
Yeah, in most cases, yeah. I mean, we specialize in like I said, it's very serious joint issues that walk in our door. So in most cases, we're able to get you some relief with our techniques that day. So, and I always tell patients that pain is usually the last thing to come about when there's an issue that's been going on for so long.
That's so crazy, right?
And then it's the first thing to go with treatment. Right. So that's always, pain is the easy part. We'll get you out of pain, in one way or the other. But it's where we kind of educate patients on the long term, make sure this goes away and this doesn't happen again.
Well, I made my first dentist appointment in 5 years because I'm not in any pain. And I'm just like, Lord, please, save me. All right, we're going to run to break. And when we get back, we have more BaaD Radio. So stay tuned. Oh, welcome back. And this portion of the show is brought to you by Body Street of Winter Park. Experience EMS Fitness Studio, where it only takes 20 minutes a week to get a full body workout. Visit bodystreet.us for your free trial.
We want to pump you up.
That's actually Stefan, the owner. He's from Germany. And there's a skit from Saturday Night Live from way, way back. And it was two guys in there, Hans and Franz, and they're here to pump you up. It's hilarious. I do have to send him the actual video. Like, I'm sure I can find a reel of it somewhere. So he knows why we were asking him to say that over and over again so that we could get that sound bite. But we're here with Dr. Dr.Kern, and she is with New Age Wellness. And we were talking a little bit about her practice. We talked about the chiropractic. And ultimately, the place that she has built, the New Age Wellness, is a place for people to go that want to take care of their bodies in a more natural way. And I've said it several times that I'm not the world's biggest fan of Western medicine. I see where it's necessary. But I also see where it causes a lot of problems, and as well as frustration. It's expensive. Trying to get done what you need to get done is, I mean, that's enough to put you on like a very high dose of Xanax, because you're just trying to get to the primary care, and all the things all the hoops you have to jump through is crazy. So for your practice, I mean, do you take insurance?
Oh yeah, we take Medicaid, Medicare, Cigna, Florida Blue, United Healthcare.
But you also do cash pay as well, right?
Yeah, if patients have, like, underinsured, then we have our cash route too for them.
Well, that's good. That's good to know. I had for some reason I had thought that you were like a concierge kind, where you was kind of like pay as you go. But so that's interesting that you do take insurance, because that's probably one of the first things that people ask you when they call.
Yeah, we try to make that not a barrier for getting the care that you need.
Right.
So we try to work with patients best we can when it comes to that kind of stuff.
Let's talk a little bit. I want to learn a little bit more about the drip therapies, because I had somebody had brought them up to me the other day, and the what they're used for and how they work. And so I was like, you know what, we're going to talk about that on the radio show. So what made you decide to bring? What are they actually called? Not drip therapies, but
Oh, well, just IV vitamin infusions. That's
infusions.
typically what they call them. We use a company called Liquivita. It's been around for a long time. And we have all kinds of drips, whether they're for boosting your immune system, helping you with beauty enhancements, supporting them nutritionally, like if you're getting fillers and you're getting certain treatments, like we do non-surgical facelifts and stuff with PRP and stem cells. So we have some that have, a lot of vitamins specifically for skin disorders and things like that.
Right. Hydration too. I think that's a big one. I know it's a big one for me, because I don't think anybody gets to enough hydration, and if you do, you just every 20 minutes you have to go to the bathroom.
Yeah. We were telling people kindly that I saw patients this morning, like, hey, it's National Refreshment Day.
I thought it was National Tequila Day.
Oh, well, that could be a refreshment. So
that's what they said on the sister station over there.
Oh,
and then another one said it was National Your Patient's Day or something like that. I was like, okay. So what is it? National what day?
It's National Refreshment Day, National Cousins Day, so if you have a cousin, and then it's National Drive-Through Day, so if you go through a drive-through. Yeah.
Oh, okay.
Support.
It's very interesting. I wonder who actually makes all these national days.
No idea. Probably all the companies that they support that have to do with the day.
The National Ferry, our producer says in my ear. Well, I want to make a national day. I just don't know which one I want it to be. So with the drip, so when do you refer to them when you're seeing a patient? When do you say do people come in specifically for it, or do you suggest it as they get to know you?
Sometimes it's a mix. We have a big sign up in our front lobby. It shows all the lists of all the types that we offer. And but if I have a patient that has a history of let's say, for instance, psoriatic arthritis or psoriasis.
Psoriasis is a skin disorder, right?
So then I say, hey, it's interesting that we can help you with this. And I had a patient actually that had a flare up, a little skin rash that had shown up in a while, and then she did our IV vitamin drip, and it went away, within that weekend. So,
and that's really, really interesting. And then I know that there was the hangover one too. I brought it up last time, and that's just supposed to make you feel better.
Yeah, just super boost of hydration and stuff.
You've depleted all of your important body, makeup. And then so you have the chiro, you have the infusion. What else?
Yeah, so just to touch a little bit more on the IVs, a lot of people we see nowadays have some kind of absorption issues. They have IBS, they have GERD, they have Crohn's disease, and a lot of these things that help inhibit, like if they're taking vitamins over the counter or supplements, they can't really absorb them because they already have digestion issues.
Why do you think that is? Is it because of our food?
Yeah, a lot of diet, lifestyle has a big effect on that. And so if you have kind of like a stomach issues in that regard, it's hard to absorb the vitamins that you're taking. So that's when I usually say, hey, maybe you would consider like once every couple months doing one of our Myers cocktails or IV infusions. That way it bypasses your stomach entirely and your intestines and goes straight to your organs and your bloodstream. So you're actually absorbing the vitamins that your organs need. So they really take that in consideration, and a lot of patients feel that they have more energy, they're able to sleep better, they have better moods, their hormones are more regulated, and all kinds of good stuff.
That sounds amazing for like premenopausal and menopausal women, because everything you just said, I was like, yes, yes, as far as sleep, sleeping isn't too bad, but as far as, I've made it through the hot flashes and all that stuff, but my body is just not what it used to be. And it's a little unfair, but...
And that's normal. Your body naturally produces less things as you age. And so that's where we recommend, hey, it's good to supplement more with either vitamins or maybe an IV if you're having stomach issues and malabsorption issues. How
do you know if you're having absorbent issues?
Just taking a valid history. I'll look at the medications they're taking, and that can be very telling, because a lot of pharmaceutical drugs have a lot of harmful side effects, and of course they're going into your stomach most of the time because you're taking them in a pill or a capsule. So our immune system lives in our gut, so it's very common to have digestion issues when you're on like a plethora of medications. So that's why one of the main top common side effects of even opioids that we talked about is constipation, digestion. All those issues are directly affected by pain medication. So, and people come to us with pain. So, obviously they're going to be
abdominal pain and stuff?
No, just joint pain. And so if they're reporting back pain, knee pain, arthritis, they're probably on some kind of anti-inflammatory. They're probably on some high prescription ibuprofen or tramadol. That's a big opioid. So they're going to have stomach issues. They're going to have malabsorption issues. They're going to have all kinds of side effects potentially.
And the drips can help alleviate some of that stuff.
Absolutely.
That's really interesting. I'm going to have to come do that, because I know that I'm active. I do eat right. I have a very hard time with protein. I try to supplement with proteins, and they all just tear me up. Like I just can't do it. I can eat meat, and that's like the only way my body will absorb protein and not make me miserable.
Yeah.
So I don't know. Is there a protein drip?
The protein drip? No, I would say get on some amino acids. There are some amino acids in some of our drips, and amino acids, when you have not enough protein in your diet, that's an easy way to get some protein.
Okay. Well, let's talk. I definitely want to talk about that, because that's a big issue with me. Because again, I like to keep myself healthy. So with the drips, and then what else was next? You had mentioned like the PRP and like some of that stuff. So how has that type part of your business grown?
Oh, yeah, great. We've seen people coming to us for all kinds of issues, specifically with knee osteoarthritis. And we work with a couple companies to do PRP, which is platelet-rich plasma. That's definitely a beneficial, great way, to help with joint pains using your own DNA. So there's no downtime. You don't have to go under anesthesia or anything like that. It's a quick 30 to 45-minute process.
Remind me what PRP. Okay. Don't let me forget that I was going to ask what PRP stands for. So, all right. I know it's platelet rich, but I need to get a little bit more
Plasma.
information. So,
Yeah.
All right. We're going to go to break. When we get back, we'll have more BaaD Radio. So stay tuned. Welcome back, and this portion of the show is brought to you by Frogger's Grill and Bar. Looking for a place to go with friends or meet new ones? And you're looking for Frogger's Grill and Bar, and with 4 great locations, there is bound to be one near you. And if you don't want to miss out on Frogger's amazing menu where everything is fresh, never frozen, Oviedo, Mount Dora, Apopka, and Altamont Springs. Visit froggers.com for more info. And I did want to mention that on July 31st, we are actually going to have the real Gravedigger from Monster Jam at Froggers in Apopka from 4P to 8P. We're going to be doing some Monster Jam ticket giveaways as well as some Froggers gift card giveaways, and we're going to have the driver as well. So if you want to get up front and personal with the real Monster Jam, come on up to Froggers. And again, July 31st from 4P to 8P. Yeah, boy! I know, we're pretty excited about that. It was a little bit of a challenge getting that all together, but we did. So we're here with Dr. Stephanie Kern, and we've been talking about several different parts of her practice, which is New Age Wellness. It's located in Castleberry, and we started to talk about PRP. But when I first think about PRP, I think about facials and fixing wrinkles and stuff like that. But then you started talking about PRP in a different light, like you're talking about muscle joints and whatnot. So tell me, how does that all work? It sounds like it's just good for all of that stuff, huh?
Yeah, so any tissue repair that's needed, it can actually regenerate cartilage and soft tissue. So PRP injections are one of the main things that people try to use when they're trying to recover from like a sports injury, or if they have knee arthritis, or if they have some kind of just joint pain in general, wherever it may be. So it could be in the elbow, shoulder, neck. We've had patients with labral tears in their shoulders get great relief. After one session, one injection, most people can expect about a 50% reduction in their pain the first week.
Wow.
And then the thing with PRP is that, it's your own platelet-rich plasma. So we're taking your own blood, spinning it around, and separating your red blood cells from your healing plasma, platelet plasma. So that's responsible for repair and cartilage, or for repair of damaged tissue and clotting and things like that. So,
and then you take that and you inject it right into the place that needs to be repaired.
And so that it signals your own body's natural repair response. So it's telling your body, hey, we need to focus in on this area. We need to, create an anti-inflammatory effect. It reduces pain, actually heals and regenerates damaged tissue, just using your own DNA. So you're your own ingredient. So
that is so amazing.
Yeah.
That really is.
It is.
But it is used in facials and whatnot as well, right?
Yeah.
So
we mix with the facials. We mix hyaluronic acid with the PRP so that you get some extra benefit with wrinkles and fine lines and collagen production. And then we can use it for hair restoration for men and women.
Oh, really?
Suffering from like alopecia or certain things. And so we mix that with a heavy dose of biotin. And then we kind of inject the area like around the crown and the sides that will have issues with growing the hair and regenerate the tissue. So
even if somebody's like just male pattern baldness, it's from their genetics.
Yeah, so male pattern baldness is a genetic issue. So you may have some significant hurdles with trying to get your own follicles to grow if you have that already in your DNA. So so some people aren't candidates, but we do like a hair skin analysis before recommending that.
Okay.
So
yeah, I mean, it's not fair. Well, for both genders, we each have the things that are not fair. So
right, that's their curse.
That is their curse. Okay. But anyway, so all right. So with the PRP, what were some of the other items that came along with that? Now, the last show you talked a lot more in detail about it wasn't PRP, but it was something else that was even more.
The stem cells.
Stem cells. Like let's dive into that a little bit, because that is I feel like that's kind of like the next wave of healthcare.
Oh, yeah. In some states and some countries overseas, they're using stem cells, mesenchymal stem cells, which are different than stem cells you would get from like your own bone marrow that they do in a transplant. So they're different. But in some states and countries, they're using these stem cells to regenerate heart, cardiac tissue or brain tissue or pulmonary tissue to help heal from certain ailments. So it's really an emerging science, but we're seeing huge clinical implications for stem cells. And so what we do with them is we use them for joint repair, patients that maybe were recommended a joint replacement surgery and aren't candidates for surgery and really have no other option to heal. And so, or they want to avoid surgery altogether, they're scared of it, and they want to avoid, that joint replacement. So that's where we come in with recommending that stem cell injection.
Would you mind telling us like an example of a story? Because I love stories. I would love to hear like somebody coming in and how you use that technique.
Yeah, so we have a couple patients. One in mind was involved in a really horrific car accident that changed and altered her trajectory of her life. She stopped working. She couldn't work in her job. And so she...
was she hit from behind?
Yeah, she was in a pretty bad accident where it was somebody else's fault.
Pull that down a little bit closer.
Oh, sure. But she had all kinds of joint issues, and she went to a spinal surgeon, and they recommended, fusion surgery. They wanted to go in there and surgically. They just go
straight to surgery usually, don't they?
In some cases. I mean, her accident was really bad, and it really caused a lot of sciatic pains, nerve pains, and she had tried everything. She'd been to an orthopedic. She'd been to a physical therapist. She'd been to, 2 or 3 different chiropractors, and she was still struggling with this pain. So we went through some treatments and even spinal decompression, and she's like, yeah, this pain is better, but it's still really, really, terrible. So, she was struggling with intermittent bouts of sciatica. She did a couple bouts of stem cells, and the sciatica went away.
Awesome.
And so she's been feeling a whole lot better, with doing stem cells. She wishes she could drink the stuff. But,
I bet they want to come in and just like hug you and be like, thank you so much.
Yeah. We've this is like definitely something that we've seen like is very promising. I mean, my nurse that does it works at other clinics too, and she's been doing stem cells for a long time, and she's been seeing crazy reports of improvements with knee pain, shoulder issues, cervical issues in their neck.
Oh, wow.
So it can be done anywhere.
Right. I think about athletes. I bring my son up on a lot because he's a student athlete. He's going to go play baseball for St. Leo University. And I think about some of his teammates that have sustained an injury that pretty much took him out of the game, because they do have Tommy John that they still perform on pitchers, but now they've been doing it before the issue even happens. So I'm wondering if that's the type of thing could help heal those types of ailments before. Well, like I said, so maybe some of these students wouldn't have to like give up a sport that they love. But
yeah, I mean, we say the same thing about chiropractic. If you're getting routine, that's why a lot of these NBA, NFL, NHL, they all have team chiropractors. So if they're getting regular adjustments, it decreases the risk of injury dramatically. So getting adjusted, making sure you're doing warm-ups properly, proper nutrition. Stem cells, just like anything, it's always better to be preventative and proactive and get something ahead of time rather than to be reactive and then try to get treatment after something's already torn, something's already injured or sprained. And so definitely preventative measures are always better.
But you can do preventative with stem cell?
Well, if there's something actually going on that could, stem cells are not going to realign your joints. So if it's just a joint problem, we're not going to recommend stem cells. But if you have some osteoarthritis or joint disease that's already in the area of complaint, or maybe not any complaints at all yet, but you have active arthritis or osteoarthritis you've been diagnosed with, it can help slow that process down from advancing.
Is that the one that's the autoimmune disease?
Oh, no, that's rheumatoid arthritis.
Okay.
Or psoriatic arthritis is also autoimmune. But in any of those cases, those are inflammatory arthritis. So they can help with the pain, and it can help slow that process down from flaring up or advancing to where, your options are very limited.
Right. Well, that's amazing. I actually got diagnosed with osteopath or the autoimmune one with arthritis, but I mean, if I take vitamins, it seems to be under control. So I'm one of those people that if it doesn't hurt, I don't worry about it. But I can't say that's the right thing to do. So, all right. Well, we're going to run to break. Time goes by so fast. And when we get back, we'll have some more BaaD Radio. So stay tuned.
Together.
Well, welcome back. And this portion of the show is brought to you by Ground Up Property Services. Do you know what your sprinkler system did last night? Probably not. So now's a good time to get your irrigation system serviced by Ground Up Property Services today. And be sure to ask Rick Hall with Ground Up about a water sensor too, so your lawn doesn't get too much water. And with the rain we've been having, that's probably a good idea. Call 407-468-4295 or visit groundupinc.net. And we've been talking with Dr. Stephanie Kern, and her business is New Age Wellness. And we've talked about a lot of the different things that she's added to her chiropractic practice. And I said during the break, I was like, what have we not hit? Because I like listing the things off and then talking about that. And one thing I definitely wanted to mention is let everybody know how to find you. So let's talk about your website for a second. So
New Age Well Chiro, New Age wellnesschiro.com.
Right.
And then you can look at all the services that we do. Goes into great detail of the type of ailments that we treat, if it's something that fits you or your condition. And if you want to know more about stem cells, PRP, and the IVs, it's all on there along with all of our payment options. And then you can click Book Now, which is it takes you directly to our booking calendar, our website, and all the time slots that are available. You can pick one on the day, and then you could put in all your information, if you have health insurance or whatnot, and even like what you want to be seen for on there. So
that's excellent. And I mean, I do a lot of work with websites, and you actually have a beautiful website. And for the audience's information, we also have educational videos that have been added. So if you're interested in listening to some of the things that we talk about on the show, you can visit her website, and then under educational videos, you'll see a lot of the clips where we talked. We take pieces of what we talk about here and put them on there. So you had mentioned a story, and I'm a sucker for stories, but it was about how your grandfather got into chiropractic in the first place.
Oh yeah.
So I would love to hear that.
So it was actually my uncle, but
cool.
He was going through his process in Northwestern University where we went to school, and before that he got into an accident. Well, it wasn't an accident. Someone had attacked him and stabbed him. So he had to have emergency heart surgery, opened him up, and saved his life. But it left him with some after effects. He wasn't able to play.
Imagine it did. My goodness gracious.
And I remember he's such a cool guy. I'd always bother him to like ride on a skateboard when I was too young. And he's like, no, don't do that because, you're going to break it or whatever. But he was a surfer, he played guitar, skateboarded, all that good stuff. And so he wasn't able to do a lot of those things, with his left arm, that goes to your heart. So he was having a lot of weakness, a lot of tingling and numbness. And so he went to a buddy of his who was a chiropractor and got some treatments. And within like a few months, he got full strength back and was able to do all the things that he wanted to do and have a better quality of life. And so he switched his studies from pre-med to pre-chiropractic. And so that's where he's like, listen, like medical is great. It saves lives and it's definitely great for emergency situations. But if you want a good quality of life and you want to have, be able to do the things you want to do in a healthy way, then natural is best. And I'm going to do chiropractic. So then he moved and opened up his practice in North Carolina. And, that was very inspiring for me.
So, absolutely. And so that really helped him get that arm movement back in. And you mentioned the tingling, because I've talked about my husband, and he had that where he had a neck. We don't even know what caused the neck injury, honestly. It was something that happened when he was younger, and it started to develop more. But it sometimes it gets so bad that he gets the full tingling in and he has to use a decompression machine. I want him to do it more often. Like, don't wait for it to start to hurt just to go back, just to do it once a month or twice a month or whatever,
Yeah.
And so it's taking care of that. But what it actually does, the decompression, it's like pulling. I just picture like it pulling.
Yeah, like an accordion that kind of pulls your spine. So I mean, and that just definitely does a lot of benefits with. It sounds like there's definitely a nerve pinched for him, and so he might have some degenerative joint disease creeping in, which is a lot of wear and tear on the cartilage in your joints. And so once that goes away, it's very hard to get it back. So to preserve it, patients do spinal decompression, and sometimes a series of them gives you more longer term benefits. If you do our whole program, which is usually about 20 visits for most cases, where you're getting up to between 2 to 4 years of pain-free relief. And then, you can maintain it with some maintenance.
It does come back, though, doesn't it?
Yeah, because what you're doing, using your spine, it doesn't stop. So, you can fill a cavity, but you're still going to eat and do all the things that you do with your, So yeah, you have to maintain it. You have to keep it. So you kick the can down the road for having very limited options, so that the more natural, proactive things that you do, the less chance of needing to do reactive, more invasive procedures are down the road. So definitely important for patients to be educated on maintenance, staying up with it, or, you'll have to, what I typically say to patients is you have to make time for wellness, or you'll be forced to make time for sickness. So
I'd rather make time for wellness without a doubt, because making time for sickness is no fun. And lots of times you can use it as a way to get away from the hustle and bustle. You're going to go get an IV drip, or you're going to go get, adjusted and do the decompression machine. You can just lay there and relax.
And I don't know what it is, but in my experience for doing this for 12 years, I always see that women are way more proactive with their health than men.
Trust me.
I don't know why or what that is. I have no idea the psychology behind it, but it's just from what I see.
I think it's stubbornness. I love you, but it's stubbornness. I think that it's just like, no, it's going to be okay. And we talked about that. I had, she's not a physical therapist, but she's a massage therapist that was on recently. And I'm like, our generation, I'm older than you, Gen X, we're the walk it off generation.
Oh yeah, rub some dirt on it.
Yeah, take some Robitussin, do something like that and walk it off. Because that was the way. But so now it's kind of like you just want to ignore it. But if you ignore it, it can cause more permanent damage in the long run, because you compensate for that. So, all right. Well, what kind of stuff do you see for the future here? I'm very, very impressed with the knowledge that you have, and what I get from you is that you absolutely have a passion and that you care about your patients. And I don't always see that. Sometimes I see people that get into it because it's something to make money, but that's not really your thing, is it?
No. I mean, I treat everybody like friends and family that come in. They're people at the end of the day, and so I've seen them. Even if we're talking about running a business and being successful, I find that the business owners that give back the most are the ones that receive the most. Yeah. And so I do everything with heart and compassion, and just to help people. So that's and a place, of course, for my friends and family to come to somebody they trust that needs some serious help. I mean, I'm giving my mom a birthday IV like next this week, so because her birthday just passed.
I was gonna say happy birthday, but it's her. Well, happy birthday to your mom.
Yeah. So yeah, I do it like the most successful people that I've ever seen are the people that are the givers. So
absolutely, without a doubt, it's the giver's gain mentality. And we have about 2 minutes left, so let's talk about your location a little bit. So where are you located at?
We're right off of the busy State Road 436, right off of the intersection of right before Red Bug Lake Road. So Wilshire Boulevard, right in the heart of Castleberry, right by the tax collector's office. So we see a big white executive building that used to be a college back in the day.
Oh, really?
And I think it was like part of City College or something like that, like decades ago, and they revamped it, renewed it.
Oh, it's super nice. I think that it's a beautiful building.
So, and we've done a lot of renovations. So everything's modern and updated. And so we're right in that area, right in.
Well, you're in that building, and so and what's your suite?
1029.
1029, and all of that information is on our website. And the lobby goes into all the different rooms with all the different wonderful things that she does for her patients. And are you going to be doing bringing anything more in, or are you going to kind of just let it grow.
Yeah, I think
way it's grown.
we're just gonna hone in on the things that we do well, and just to be like forefront. We only accept patients that we think we can help. If it's a patient that we don't think we can help, then we'll send them somewhere else. So we like to just stick with the things that are in our lane, and if somebody's looking for something else, then we'll say, hey, go see our friend Dr. So-and-so at this office instead. So I think right now, that's all we're going to be adding for the near future, and so we'll keep you up to date.
Well, thank you so much, and thanks for being on the show again. I always love having you on, and I want to give a huge thank you to our sponsors, and thank you for tuning in. Have a great week, and remember, everyone, to support local.